Hello everyone, welcome to my Medication Academy channel. In this video, I will be reviewing SGLT2 inhibitors. This is a class medication called sodium glucose cotransporter 2 inhibitors. Currently in the US, there are 6 SGLT2 inhibitors on the market. As you can see, all the drug names, they contain gliflozin in the suffix. So that's indicating this is a member of SGLT2 inhibitor class. So this sodium glucose cotransporter 2 inhibitors, this class of medication are indicated for improving glycemic control in adults with type 2 diabetes as adjunct to diet and exercise. And note, Invokana, so the first medication here was approved in 2013, was also approved to reduce the risk of major adverse cardiovascular events in adults with type 2 diabetes and establish the cardiovascular disease, as well as to reduce the risk of end-stage kidney disease, doubling of serum creatinine, cardiovascular death, and hospitalization for heart failure in adults with type 2 diabetes and diabetic nephropathy with albuminuria. Farxiga and Jardiance were also approved for heart failure and chronic kidney disease. And notably, the last medication on the list, sotagliflozin Inpefa, this medication was only approved for reducing the risk of cardiovascular death and hospitalization for heart failure and urgent heart failure visit. This class of medication, SGLT2 inhibitors, they all taken once daily by mouth. And dosing adjustments are needed for patients with impaired renal function. Mechanistically, this class of medication, SGLT2 inhibitors, works to block SGLT2, that's the sodium glucose cotransporter. And so by blocking SGLT2, this would lower the blood sugar by blocking glucose reabsorption. So therefore, this will increase the excretion in urine. Basically, this medication blocks the reabsorption process at sodium glucose cotransporter 2, and then patients will pee glucose in the urine. Contraindications in general for this class of medications, they all have this contraindication, hypersensitivity to the drug itself or any of the excipients within the drug products. With regard to adverse effects, female genital mucotic infections, urinary tract infections, nasopharyngitis, and increased urination. Let's take a look at the pharmacokinetic profiles for this class, SGLT2 inhibitors. As mentioned earlier, so all the drug names, they ending with the gliflozin kind of suffix, and bioavailability for this class ranging from 25% to 100%. So except this sotagliflozin Inpefa, so has lower bioavailability about 25%. The other range from 65% to about 100%. Tmax, you can see that's the time to reach the maximal drug concentration in the blood. So it takes about 1 to 2 hours, or in this bexagliflozin, so the Tmax range from 2 to 4 hours. The half-life, so you can see it's relatively long half-life, so about typically over 10 hours. So you can see, but for Inpefa, you can see for single dose, the half-life is 21 to 35 hours. As mentioned, all the medication from this class, they are taking once daily dosing. Most medication from this class, they have 2 dosing regimen, except bexagliflozin only has 1 dosage form, 20 milligram. But the other medication, you can see they all have 2 dosing regimen. This class medication, you can see they pretty much they have high protein binding, so ranging from about 86% to about 99%. Metabolism. So this class medication is mainly metabolized by phase 2 conjugation metabolism by UGT enzyme. So that's the uridine 5' diphosphoglucuronosyl transferase enzyme. But in some cases, the CYP450 enzymes, so they play a minor role in metabolism. Excretion. In the urine, you can see majority of the products as the metabolites. In the feces, so you can see that majority of the drug molecule will be excreted as the parent drug molecule. So this class of medication, the first medication was approved, that's canagliflozin in 2013, and then last decades also, you can see there are 6 drug products which have been approved by the US FDA. The most recent one, that's the sotagliflozin. It's a SGLT2, SGLT1 inhibitor, which was approved in 2023. So now I'm going to highlight a few agents, more recent approved agents from this class. This Steglatro, that's the brand name. So this medication was approved by the US FDA on December 19th, 2017, and indicated to improve glycemic control in adults with type 2 diabetes as adjunct to diet and exercise. Recommended dosage for this medication starting 5 milligram orally, taken in the morning once daily with or without food, and then increase the dosing to 15 milligram once daily if tolerated and needed. Not recommended for patients if they have impaired renal function for eGFR less than 45. This medication is not recommended. As you can see, this medication is available as a tablet, kind of 2 dosage regimen, 5 or 15 milligram tablets. If we look at the drug chemistry, so in this case, there is a modified glucose motif on the left side, and then there is a phenol ring in the middle, and another phenol ring in the peripheral side on the right side. Molecular weight for this medication, 436.88 gram per mole. Hydrogen bond acceptor 7. Hydrogen bond acceptor refer to the number of nitrogen and oxygens within the drug molecule. Hydrogen bond donor is 4. Hydrogen bond donor refer to the number of hydroxy group or the NH group within the drug molecule. In this case is 4. Log P is 2.74. Polar surface area is 109 square angstrom. Mechanistically, as mentioned earlier, this class of medication, gliflozin, works as a sodium glucose cotransporter 2, SGLT2 inhibitor, and this would lower the blood sugar by blocking glucose reabsorption process, so therefore make the glucose excreted in urine. Pharmacokinetically, the Tmax is 1 hour under fasting conditions. It's about 2 hours under fed conditions. Half-life 16.6 hours. Bioavailability is about 100% in this case. Protein binding 93.6%. Volume of distribution at steady states 85.5 liter. This is based on the RV studies. Metabolism, this medication will go through the phase 2 metabolism by the enzyme UGT. Again, that's the uridine diphosphoroglucuronosyl transferase 1A9 or 2B7. Excretion in the feces 40.9% and then 33.8% as a parent drug molecule. In the urine, 50.2%, mostly as metabolites, only about 1.5% as a parent drug molecule. Drug-drug interactions. Positive urine glucose test. SGLT2 inhibitor will increase the urinary glucose excretion. So therefore, this would lead to positive urine glucose test. For patients also take some other anti-diabetic medication, for example, insulin and insulin secretagogue, concomitant use with Steglatro will increase the hypoglycemic risk. Lithium medication may lower serum lithium concentration. So the lithium medication, that's the mood stabilizer. So therefore, for patients to take lithium as well as Steglatro, so this would lower the serum lithium concentration. So therefore, need to monitor the plasma lithium level closely. Contraindications: hypersensitivity to ertugliflozin or any excipients within the drug products. Adverse effects: at least 5% of a patient population, female genital mycotic infections. The next medication I will be highlighting today is bexagliflozin, the brand name that's Brenzavvy. This medication was approved by the US FDA on January 20th, 2023, and indicated to improve glycemic control in adults with type 2 diabetes as adjunct to diet and exercise. Recommended dosage: in this case, the medication is available as 20 mg tablets, 20 mg orally, taken in the morning once daily with or without food. For patients with impaired renal function, if eGFR less than 30, this medication is not recommended. If we look at the drug chemistry, on the left side, so that's the glucose motif, and then in the middle, so that's chlorine phenol motif, and then there is kind of different moiety, the chain on the right side. Molecular weight is 464.94 gram per mole, 100 bond acceptor 7, 100 bond donor for log P is 1.67, polar surface area is 109 square angstrom. Mechanistically, this medication works as a member of sodium glucose cotransporter 2 inhibitor, lowering blood sugar by blocking glucose reabsorption process, so therefore making the glucose excreted in urine. Pharmacokinetically, Tmax it's 2 to 4 hours. Elimination half-life about 12 hours. Protein binding approximately 93%. Volume of distribution is 262 liter. Metabolism: the major metabolic pathway for this medication conjugates with glucuronic acid by this enzyme UGT. That's the uridine diphosphoroglucuronosyl transferase 1A9. That's the major metabolic pathway, and this also will be subject for CYP3A enzyme. That's a minor metabolic pathway. Excretion in the feces 51.1, majority as the parent drug molecule. In the urine 40.5%, but majority as metabolites. Drug-drug interactions. Given this medication, you can see metabolized by UGT enzyme go through the phase 2 conjugation metabolism. So therefore, for medication, if they are UGT enzyme inducers, So this would facilitate make the drug molecule metabolize much faster. So UGT enzyme inducers concomitant use may lower the Brenzavvy exposure. So examples for UGT enzyme inducers, for example, rifampin. So that's the anti-tuberculosis medication. For patients also taking insulin and insulin secretagogue, concomitant use with the Brenzavvy medication will increase the hypoglycemic risk. For patients, if they're also on the mood stabilizer lithium, and this would lower the serum lithium concentration. So therefore, monitor the lithium concentration, plasma concentration closely. Contraindications: hypersensitivity to bexagliflozin or any excipients within the drug products. The most common adverse effects, more than 5%, female genital mycotic infections, urinary tract infection, and also increased urination. Again, if you think about how this class of medication work, because this one will make patients pee glucose in the urine. So with the glucose in the urine, so therefore this would pose the risk for bacterial or fungal infections. Sotagliflozin, the brand name Inpefa. This medication was approved by the US FDA on May 26, 2023, and indicated to lower the risk of cardiovascular death, hospitalization for heart failure, and urgent heart failure visits in adults with heart failure or type 2 diabetes, chronic kidney disease, or other cardiovascular risk factors. Recommended dosing for this medication starting 200 mg orally daily. Take not more than 1 hour before the first meal of the day, and titrate to 400 mg if tolerated. As you can see, this medication is available as 200 and 400 mg tablets. Drug chemistry. Again, so this one have the methyl ether and the glucose, modify the glucose derivative. And then still have 2 phenol, and then in the middle, that's the author chlorine, the phenol motif. Molecular weight for this medication is 424.94 gram per mole. Hydrogen bond acceptor 5, hydrogen bond donor 3. Log P 3.76, so therefore it's a pretty lipophilic drug molecule. Polar surface area is 104 square angstrom. Mechanistically, this medication kind of works different from the other medication we talk about, because this one works as a dual inhibitor for SGLT2 and SGLT1 inhibitor. With regard to SGLT2 inhibition, this will lower the renal reabsorption for the glucose, as mentioned earlier, decrease renal glucose reabsorption. So therefore, this would decrease the pre and after load of the heart. With regard to SGLT1 inhibition, so this would reduce intestinal absorption of glucose and sodium. So therefore, this would have increased the risk for diarrhea. Pharmacokinetics, bioavailability is about 25%. Tmax 1.25 to 3 hours. Half-life 21 to 35 hours. Protein binding is over 93%. Volume of distribution is 9,000 liters, so it's a very large volume of distribution for this molecule. Metabolism, UGT1A9, again, this is a phase 2 conjugation metabolism with glucuronic acid. So this is the enzyme, the uridine 5' diphosphoroglucuronosyl transferase 1A9. This is the major metabolic pathway, and this medication will also be metabolized by CYP3A4 enzyme as a minor metabolic pathway. Excretion in the feces 37%, but 23% as the parent drug molecule. In the urine 57%, 33% as metabolites. Drug-drug interactions, UGT enzyme inducers, for example, rifampin, concomitant use. This will lower Inpefa drug exposure, so therefore monitor clinical status. Digoxin, for patients take digoxin, for example, treats the heart disorders like heart failure, monitor digoxin levels closely. Lithium, this may lower serum lithium concentration, so therefore monitor plasma lithium concentration closely. Contraindications, history of serious hypersensitivity reaction to Inpefa. The most common adverse effects, at least 5%, urinary tract infections, volume depletion, diarrhea, and hypoglycemia. As mentioned earlier, you can see the adverse effect diarrhea. So this is largely due to inhibition of SGLT2 inhibition. This is all the key reference which I have used to prepare for today's video. All the information are shared today, so they're pretty much based on the prescribing information. But also, depending on when you watch the video, it's always the best practice to check the most recent prescribing information, because medical information is rapidly evolving. In some cases, the prescribing information is very often updated. Finally, I want to thank you so much for watching. If you enjoyed the video, consider subscribing for future medication video updates. As always, keep learning and elevating. Thank you so much.